Hey guys, this is Dr. T. Foster Bryant here at Movement Spine and Rehab. I'm here with Bolton. I'm here with Jennifer, and we just got going over their 980 X-rays. And this is a really unique case, so I figured it'd be good to stop and have a little talk about it. So, talk about what brought you guys in here initially about 4 months ago.
Bolton got injured playing football, and he was temporarily paralyzed, and his neck did not have the curve. The doctors were telling us we had to have surgery. We came in and seen Dr. T. Bolton would come in 3 times a week, do his therapy, do exercises that he had told us to do at home, and now the bend's back in his neck.
Yeah, and that's the quick version of it.
Yes.
And but basically, when Bolton got hurt, he had MRIs. It was a very serious situation.
We had went to 9 different doctors.
Yeah, and it was tough, when your kid's hurt and you got everyone telling you one thing and we're telling you maybe a little something different. And it isn't that we didn't see how important the injury was, but we did our due diligence and made sure that before we began care, it was safe to be in care with them. And once we started in it, we do chiropractic biophysics, which is the most referenced and researched of anything in the history of the chiropractic profession. And I have a fellowship in pediatrics. So I have a long-term history in dealing with injured athletes, specifically football players too. But why don't you talk a little bit about what you noticed and the changes you felt since you've been coming in here?
The changes I felt is my head used to sit way down like this, but now since I've done the compression therapy and everything, my head's been leaning more back this. And I have done a little bit of practice hitting, but nothing with pads yet, and I noticed I can keep my head up a lot easier and all that.
Yeah, and he actually had because the curve in your neck is what gives the structural strength to hold you up. When your curve in your neck bends and folds over, you're at risk, especially when you're a linebacker. If you come in and you drop your head down and hit, you can impinge your spinal cord. And that was the fear, and that was the reality of what he had happened. And so now, with actually rehabbing that curve into his neck, now he has a totally normal neck, very strong curve that puts the weight into the back of his neck where his disc and his nerves are not going to get pinched and compressed. So he's been cleared. He's able to go back and continue football. We're going to do some safe measures. He's going to do a little bit of maintenance care too on the back side of it, but we're going to put a bull collar on the back of his pads too to give him more absorption. But the great thing is now when he comes in and makes a hit, he will be able to biomechanically get his head up into the correct position so he can make a correct tackle the way we are supposed to make a tackle. Anything to add, like moving forward? I've been injured badly in sports, and there's a little bit of a, man, I don't want to go through that again. How do you feel about going back to football? What are you thinking?
Going back to football, I say it's been a little weird because since you've got the injury, you're gonna have a little hesitation at first, but you just gotta go out and do it and just hit again, you'll be fine.
Yeah. Anything to add?
Yes, we also, with having this injury and then having the x-rays, we also noticed that he's got one leg shorter than the other. So now he has a lift and he feels faster and stronger, correct?
Mm-hmm. Yeah, and that'll also will help with the lifting, exercising, and people that have an anatomical leg length inequality, 80% of people have this. So if you have back pain, that's a big causative factor a lot of times. But for athletes, when the pelvis drops down, you also put your knee and your ankles at risk. So there's a high correlation to ACL tears on that side too. So I've had 3 knee surgeries. My wife has had 6. We do not want young athletes, to go through the same things we did. So when we find weaknesses or instabilities or abnormalities in their spine that we can correct, the goal here is to actually fix those things, rehab them, and then teach Bolton how to continue to maintain the results. So great job, great support.
Thank you, Dr. T. We're very happy.
Well, we appreciate it.